For our work, the general rule still applies that we should work from home as much as possible. Recently, however, we have started a couple of pilots for research that requires laboratories within the buildings. By monitoring this process very carefully, we will learn lessons for the future upscaling of our research. The priority will be given to PhD and postdoc projects in order to minimize delays for these colleagues. And it's very important to emphasize that the health and safety of our employees during these pilots always comes first.
The goals of the Task Force Smart Startup was to discuss across different faculties that are all using the same facilities or buildings here at the health campus in Randwyck to coordinate our decisions and our procedures. You have to think about a registration system, make sure that you always know how many people are exactly where in the building. You have to think about hygiene measurements, of course, and think about difficult places inside the building where the 1.5 meter distance may be challenging. We invited every lab coordinator to develop a new protocol, how research should be conducted in order to follow the new guidelines and regulations.
It is very important for the Maryland research to be back on the campus. About 90% of our research is lab-based, so we need laboratories, we need equipment to do the core research. It is also very important for many of our PhD students and postdocs who come from all over the world and do not have family and social network here to be back in a lab and meet their colleagues. We had to open the labs from early in the morning until late in the evening, and to work in 3 shifts in order to accommodate everybody's work. We needed to buy screens, like plastic screens, to separate different locations in a lab. All people working in a lab, they have to make a planning that needs to be approved before they are allowed to go back to the lab. And at all times we have at least 1 principal investigator and 1 lab manager available for questions at all times. When I announced that we could open the lab again and that people could come back, everybody was excited and do what they're actually supposed to do as a PhD student and postdoc. You are supposed to be in a lab and pipettes, and that is what they can finally do again.
Participation in these pilots is solely on a voluntary basis, and if you would like to come to work in our buildings, please consult your manager first. Help us in this undertaking and stick to the rules and keep each other healthy and safe.